Hi, I'm Larry Gostin. I'm the co-faculty director of the O'Neill Institute for National and Global Health Law here at Georgetown University. I'm the director of the World Health Organization Center on Global Health Law. I wish I could be with you today in China, but unfortunately I'm unable to be with you, and I'm in Washington, D.C., but soon to be traveling to Asia myself. I'm going to talk about global health security in the age of COVID-19. During COVID-19, we learned about deep inadequacies in our health systems and our ability to prepare for and respond to novel infections. And we've seen this before with other health crises, from SARS to Zika, through to West African Ebola epidemic, and more recently, Mpox. I'm also chairing a committee for the National Academies of Science and the White House on preparedness for smallpox, another potential danger. What I wanted to do is talk about what it takes to be prepared. And I'm going to do it from a global perspective and draw upon the negotiating processes that are taking place as we speak in Geneva at the World Health Organization and also at the United Nations. There were many inadequacies during COVID. Problems of early reporting, of sharing scientific information and pathogen samples, but also notably unconscionable divides in our ability to allocate vaccines, diagnostics, and therapeutics in a way that's equitable and fair. In particular, low and middle income countries, particularly in sub-Saharan Africa, never got their fair share of life-saving vaccines and other medical countermeasures that were necessary. And so how can we do better next time? Well, as you may know already, there are, I would say, 4 historic processes that are underway in the world today for global health security reform. The first one is the financial sustainability of the World Health Organization. And in May 2023, the World Health Assembly historically resolved to increase assessed or mandatory contributions to the World Health Organization by its member states, up to a much higher level than it's been in recent history. That will enable the World Health Organization to itself have stronger institutional capacity to deal with global health emergencies. Secondly, in September of 2023, the United Nations General Assembly adopted a UN political declaration on pandemic preparedness, prevention, and response, with clear calls for better equity, better preparedness. Although the UN declaration was just aspirational and not binding, it could lead the way to more binding norms and enforceable obligations in 2 further processes that are taking place in Geneva right now. One is reform of the international health regulations. I was proud to be a member of the WHO-IHR Review Committee. I served with a very good friend and distinguished scholar from China, as well as many countries around the world. There have been about 209 proposals from member states across the world for reform of the international health regulations, which have been the governing instrument for handling novel outbreaks ever since 1948, when the World Health Organization adopted the international sanitary regulations, which are now called the International Health Regulations. In 2005, the World Health Organization made a fundamental reform of the international health regulations in the aftermath of the SARS epidemic, which I know affected China very much, and also Ontario in Canada. So there were major reforms then. But then during COVID-19, the international health regulations still did not perform very well. There was widespread nonconformance and compliance with the regulations, particularly with a lot of travel restrictions that were targeted against countries. There wasn't full sharing of information about the science and pathogens or genomic sequencing data. And countries, even though they had promised to have strong health system capacities for laboratories, healthcare facilities, legal regulation, surveillance, and many other core capacities, most countries of the world failed in that regard during COVID. As a result, there's been a wide consensus around the world that we need to reform the international health regulations. And I'm very confident, knowing the negotiations that are taking place in Geneva, that we will get to a stronger position on the international health regulations in time for the May 2024 Health Assembly, when WHO states parties are due to make recommendations to the Assembly that I think will be adopted. The second process is going to be much more difficult. And this is one for the negotiation of what's called the Pandemic Treaty. But it's really being called in Geneva these days a Pandemic Agreement, because it's unclear yet whether it will be in the form of a framework convention or a treaty, or whether or not it'll be a different kind of an international legal instrument. At the moment, I'm expecting it to be a framework convention under the WHO Constitution. The origins to the pandemic treaty idea go back to right in the middle of the COVID pandemic, where about 30 countries around the world, heads of state, and also international organizations like WHO, urged the adoption of a brand new treaty that dealt with pandemic preparedness and response. The World Health Assembly then charged an intergovernmental negotiating body called the INB to negotiate this. And that's what's happening in Geneva right now. While I expressed optimism that the international health regulations would be successfully negotiated by May 2024, it's very unclear whether or not the pandemic agreement will also be ready in time. The due date is still the May 2024 World Health Assembly, but there's widespread concern in Geneva and capitals around the world that we may not be able to come up with an agreement by then. But we're still aiming for that and hoping for that. And in any case, if it is a framework convention, it would be the second such framework convention in the history of the World Health Organization. The first one is the Framework Convention on Tobacco Control, which has been highly successful. The beauty of a framework convention approach, or what international lawyers call a framework convention and protocol approach, is that it can set general boundaries, general norms, and leave it for additional amendments or protocols to be issued later in time. And so it's possible that we might come up with a negotiated treaty for May 2024, but many of the sticky points will be decided by what's called the Conference of the Parties, which is all of the states parties to the convention. And they will then issue or adopt protocols that could then be enforced and become part of the treaty. So now what I want to do is spend a few minutes talking about the major issues that are going on in Geneva and why they are necessary to make for a stronger, more fortified approach to global health security. The first one is the most basic, and that's to have robust health systems. It's impossible to rapidly detect, report, respond to, and coordinate an international response to a novel outbreak without a robust health system. So every country in the world, this includes China, the United States, Europe, but also low and middle income countries, for example, in sub-Saharan Africa, the Indian subcontinent, parts of Southeast Asia, Latin America, and the like, where you have relatively weak health system capacity. So we need to detect an outbreak. We need surveillance systems, including genomic surveillance systems. We need wastewater surveillance and active reporting surveillance. We need strong epidemiological capabilities. We need a health system that can have a surge response to a surge in illnesses and deaths in the country. We need strong public health laws, both for regulation of pharmaceuticals and vaccines, but also for general public health regulations and strong public health authorities and powers. Right now, by their own admission, most countries fail to meet these core health system capacities. And moreover, there's no objective independent verification and evaluation of whether or not countries meet these minimal standards for health system capacities. So that's the first major issue. We need to have strong health systems. We need to fund these health systems. We need technical assistance, and we need independent, objective evaluation and ongoing improvement of these health systems. This is going to be a really hard job because it requires continual financing. That is, countries need to invest in their own health systems, and higher income countries and highly capable countries like China and the United States need to provide technical and financial assistance to ensure these health system capacities. So first and foremost, we need strong health systems everywhere. And if you've got a weak health system in any country, it's a problem everywhere because we're only as strong as the weakest link. The second thing we need is rapid, accurate, and transparent sharing of information, particularly scientific information. We did really well with COVID-19 and being able to develop highly effective vaccines within a year. There were Chinese vaccines like Sinovac. There were US-based vaccines like the messenger RNA vaccines or the Novavax vaccine. In Europe and India, the Oxford AstraZeneca vaccine were all tremendous accomplishments. But we need to share that information in the future quickly. That means that countries, if they identify a natural pathogen, that they have to be willing to share samples of that novel pathogen to the wider WHO scientific community, so that we can develop the kind of therapeutics, vaccines, diagnostic, personal protective equipment that are absolutely necessary to deal with a pandemic. And we need those rapidly, and we need to develop our medical countermeasures quickly. This also includes genomic sequencing data. One of the things that China did fairly early on is it sequenced SARS-CoV-2, and it shared that with the World Health Organization. South Africa, when it identified the Omicron variant, it absolutely shared a genomic sampling, but we don't always have this. And a lot of countries don't share their pathogen data or their GSD data. So we need highly transparent, open forms of scientific communication so that we can develop countermeasures very, very quickly. At the same time, we need to be able to rapidly allocate and fairly allocate those countermeasures across the world. So what does that take? Well, one thing it takes is an infrastructure. And so you might have a vaccine, for example, but unless you have cold storage that can deliver the vaccine to rural villages and cities in a country in a safe and effective way, you can't get the vaccine into people's arms. Unless you have trained healthcare workers, you can't vaccinate and put things in people's arms. Unless you have truthful, good, reliable information, there will be mistrust and people won't accept vaccines even if they're available. So all of those things were a problem in delivering and having social acceptance of vaccines. And they still are all across the world, particularly with a lot of misinformation on social media. And then finally, but most importantly, we need equity. During the COVID pandemic, rich countries like the United States, Canada, the European Union, the UK, pre-purchased their vaccine stock. And as a result, there was a global shortage. And innovative structures like the Gavi Vaccine Alliance or COVAX, which is the vaccine arm of WHO's partnership called the ACT Accelerator. All of these things were wholly deficient. And as a result, we had, as Dr. Tedros of WHO said, a catastrophic moral failure during COVID-19. And it's very possible we'll still see that kind of huge moral failure in the next pandemic unless we fix equity. So what are the major drivers of the disagreements in Washington, Berlin, Strasbourg, and other capitals of the world in terms of equity? The problem is that we don't have an agreed solution. And low and middle income countries, particularly the African bloc, are insisting that they won't share their pathogen and genomic sequencing data unless there's a strong, robust mechanism for equity. This could include things like what's called a pathogen access and benefit system, an ABS system, which is like the pandemic influenza preparedness framework that really says to countries, if we share pathogen data with you, you must provide certain benefits in terms of the equitable allocation. But there are also much bolder proposals And these include intellectual property rights waivers during health emergencies, which are highly controversial and which the German health minister said was a non-starter, and technology transfer. This is the idea that, companies that are innovative companies like Pfizer and BioNTech or Moderna need to share their know-how, their scientific know-how with low and middle income countries. The World Health Organization has used what they call the mRNA, messenger RNA hub. It's a network of manufacturers in low and middle income countries that could produce their own vaccines. The first one is in Cape Town, South Africa. Why this is important is because what any African can tell you is that when they wait for charitable donations of vaccine doses, it's always too little, it's always too late. And so they want the capacity to manufacture their own vaccines, pharmaceuticals, diagnostics in the region, so they don't have to rely on the goodwill of China, the United States, or Europe, or the UK. So equity has become front and center. It's actually at the heart of the pandemic response that we're trying to fix. A final thing I want to talk about is sustainable funding and accountability. It's one thing to promise all these benefits. It's another thing to sustainably fund them. And at present, the pandemic agreement and the IHR reform have no robust funding mechanisms. The World Bank has launched a pandemic fund, but it's woefully inadequate in terms of its capacity to help low and middle income countries. And as we speak, there is no robust financial pledge or mechanism on the table in Geneva, at the World Bank, at the G7 or the G20. And those are huge problems, particularly for the African bloc, along with equity. And then finally, even if we were able to negotiate and agree on a very robust pandemic treaty, a treaty is only as good as whether or not countries actually abide by it. And so what we need is compliance mechanisms, we need enforcement, we need transparency, we need good governance, and we need accountability, so that the promises that countries make and the pledges they promise are actually kept. And that's hugely important for the future of global health, because what we've seen throughout history, and I've written a whole book about this called Global Health Security for Harvard University Press, which is that we lurch from complacency during periods of calm to panic during periods of epidemics or pandemics. We saw this with SARS, Mpox, COVID-19, and Ebola. We need to stop this vicious cycle of complacency, panic, and then back to complacency. Right now, we have an historic, once-in-a-lifetime opportunity to make things right, to make the world safer, and to make it more equitable and fair. If we fail to do this now, with all the opportunities before us, we will lose the chance to improve global health security for our entire lifetimes, maybe our children's lifetimes. There are a few things that we owe to the younger generation, to the children. One of them is that we need to leave them a safe, clean, healthful planet. We need to provide them with education and all the basic necessities like food and potable water and electricity. And we need to future-proof them against fast-moving pathogens that can cause epidemics and pandemics. So far, the world is failing our children. As somebody who has children and has grandchildren, it means a lot to me to leave this world for them in ways that are clean, healthy, and safe. We have the chance to do something about it now, and shame on us if we don't take it up. Thank you very much for the opportunity of talking with you. I hope to see you next time in person in China. And I send my warm wishes from the O'Neill Institute at Georgetown University in Washington, D.C.